Well, this next segment is just for the ladies, okay? If you are experiencing pelvic pain and you can't understand what is going on with your body, we may have some answers for you. Dr. Burt Webb from Scottsdale Center for Women's Health is here to tell us about fibroids. And I think a lot of people don't understand what they really are. I've heard the term, but what are they exactly?
There is a great deal of misunderstanding about fibroids, and fibroids are a part of the uterus that starts to grow into a ball, a little bit like a pearl in an oyster. And they are benign, which means they are not cancerous and they never become cancerous, contrary to what most people think.
What causes them though?
We don't know.
Really?
Yeah, we don't really understand what makes them grow. You always hear that hormones do.
Right.
And women are told, well, when you hit menopause, your hormones stop, so fibroids stop growing, but that's not true. Plus, a lot of women who are postmenopausal will take hormones and their fibroids grow. So I think the key thing is that women need to be aware that they can have fibroids.
Okay.
And when I was coming down here, I was talking with a nurse practitioner who said, well, after she had her child, now she feels kind of full and heavy. And I said, well, have you had an ultrasound? And she said, no. And so women who feel full and heavy, who have some bleeding issues, either heavy bleeding, painful bleeding, women who are having trouble getting pregnant, those are people who should get an ultrasound.
Really?
Yeah.
Okay, it's that simple. It's an ultrasound.
It's that simple.
Now, let's talk about how you treat them. Once, so if you do determine that there are fibroids there, how do you take care of them?
It's a great question. The key to that is really learning where the fibroids are. So in our office, we do an ultrasound on most everyone, and we determine where the fibroids are, which is really important. And if they're on the inside, then I can treat them very easily with an outpatient procedure.
And is that what we're looking at here?
Yes.
Was this from an outpatient procedure?
Yes. So this is something about the size of a straw that I put into the uterus. The woman's asleep at an outpatient center.
Okay.
And I'm removing her fibroid, or it looks like it's mostly all gone now. Yeah, it's all gone.
Okay.
And she'll wake up 30 seconds after I'm done. An hour after we're done, she'll be going home, and that night she'll be going to the movie or out to dinner. She'll have no pain.
That's amazing.
It is amazing. And this can cause lots of problems for her, from bleeding to infertility to cramping.
Okay.
And she would never know it unless she'd come in and...
I have a question for you. Are they hereditary?
That's a great question. We don't know the answer to that.
Okay.
They're so common, they occur in 50 to 70% of women. So 2/3 of all women have them, but only about 20% of women will have problems.
So when you say, you know, the feeling of fullness, is that the beginning of a fibroid? And then when you have the heavy bleeding and the pelvic pain, is that like a lot of fibroids, or how do you know?
That's more what I specialize in, is someone comes in and says, I have some fullness or leaking or bleeding problems, and I differentiate what those problems are and then direct them in the right way. So. Typically they won't come in with fullness. Most women don't know that they have fibroids.
That's amazing. That's why a simple ultrasound
Right.
is so important, and prevention is the key, right?
Right.
Excellent. All right. Well, Dr. Webb, thank you. Really good information. I know a lot of ladies at home are probably going, you know, I have been feeling that way and I don't know why. Well, let me give you some information on how you can find Dr. Webb. He is at the Scottsdale Center for Women's Health. They're located at 8415 North Pima Road. That's in Suite 210 in Scottsdale. Here's a number to call. It's a simple ultrasound, ladies, 480-425-8700. Learn more on their website, scottsdalewomenshealth.com.